Hi, I'm Dr. Mel Crane from the University of Sydney and the Australian Prevention Partnership Centre. I'm going to talk to you about natural experiments and a study we conducted to understand the utility of natural experiments. So what is a natural experiment and why do we need to use them? Well, a natural experiment is an experiment in that exposure and outcomes are analysed using methods that attempt to make causal inference. However, in this situation, the researcher has had no control over exposure to the event, but uses the opportunity it presents. So an example is the current COVID crisis, and it's provided the opportunity for researchers to undertake a number of studies to assess a variety of issues using the COVID as an exposure. So why are these studies necessary? Because planned controlled experiments like randomized control trials are rarely appropriate or possible in many public health situations. Also, research evidence may be required quickly, like policy decisions. So we need research evidence that can be generated that accommodates for these opportunistic research needs. So the question is, how can natural experiments help to build evidence for obesity prevention? Well, issues like obesity are complex, driven by multiple interrelated factors, including environmental, social, cultural factors, not just the individual behaviour. Prevention requires interventions that target multi-level systemic factors, such as taxation, restrictions on unhealthy food, and healthy food availability, as well as changes to the built environment. But evidence of the effectiveness of such interventions is lacking, so we're limited by a real lack of evaluation evidence. So we conducted a study to investigate the utility of natural experiments in obesity prevention. We searched peer review evidence of literature for studies that described as a natural experiment and aimed at improving either nutrition, physical activity, or obesity specifically. I won't go into the methods or the characteristics of interventions or methods such as this table, but for more information you can email me directly or search for the paper that's just been published. So in terms of utility, the kind of information we were looking at was to determine the need for population health research evidence, as well as things like the ability for researcher manipulation of exposure conditions, ethical constraints, and practical considerations that may prevent a planned researcher-controlled study. So some of the evidence that we found, well, the purpose of studies were largely to evaluate the effectiveness of an intervention or the impact of a policy. Fewer studies were aimed at exploring health inequalities or looking at environmental social determinants. Now, planned researcher-driven research was not always feasible to answer the research question. However, partial control over intervention may have been possible in some of the circumstances to collect baseline data. However, if a policy is enacted quickly, this will be restricted. We note that studies that aimed at assessing inequalities in the population would have been unethical as a planned experiment, where there was a risk of potential harm from restricting access to medical care or economic support, or randomising groups to receive a social benefit or their freedom to migrate. And a number of other practical considerations also necessitated the need for a natural experiment, which I won't go into in detail. The implications of the study, well, firstly, what are the strengths? Natural experiments enable evaluation of processes and outcomes of policies and interventions within the real-world complex social political conditions in which they operate. They offer opportunistic evidence where RCT methods may be impossible due to things like timing or exposure, and they offer this flexibility to use a range of research questions, intervention settings and scale, as well as evaluation methods. However, this increases the difficulty for making comparisons across studies. Now, they're often criticised for their inability to eliminate bias, particularly due to confounding. We caution, though, that deciding against the use of natural experiments ignores the contribution that they do make to the overall evidence generation, particularly in regards to this complex real-world situation. And by ensuring good study design, some of these weaknesses can be reduced, such as having a control group comparator. What we found was that less than a third of the studies we assessed had user-defined exposure and control group. And a number of studies were just post-evaluation observations. Given these studies are often opportunistic, finding an unexposed group may be difficult. And this is easier in environmental interventions where there's greater potential for the researcher to be involved in establishing baseline data points. And it's a bit harder with policy evaluation sometimes. However, some studies have used things like modelling simulations to create a control group comparator, and others used step wedge designs. Overall, in conclusion, I'd say that in response to the complexity of obesity, obtaining policy and intervention impact evidence is critical, and natural experiments may provide innovative translational research evidence on obesity policy interventions that has been missing.